Let's see if Facebook got a notification. Good night. Good night. I'm waiting for my notification. I have not received it yet. As you come on, guys, please wake up everybody. Share this live. Call your nurse friends. Call everybody. We're going to have a discussion tonight. Come on, Facebook. Where's the notification? Good night, everybody. As you come on, please share this live. Help me to get the algorithm shaked up here because I'm waiting for my notification. I have not received it. So please help me, guys. Good night. Good night. Welcome. TK's Event Naturals. Where were you today, girlfriend? Where were you today? You know, after I came off the live, I said, hold on, how comes when I say Event Naturals Canada? And I saw me know your name, you know. I know you by your other name. I was wondering where were you today? Please share this live, guys. It's going to be a very interesting discussion tonight, a subject matter that may be considered sensitive. But you know how we do, we keep it real, uncut, unfiltered, just raw as ever. You know, you get the real deal here. I'm Royal Cleopatra. Please share the live, guys. Oh no, I don't get my notification. You know, it's my first time coming back live for a long, long time using this medium. And I'm trying to see how the algorithm works. You know, maybe I'm going to have to use Facebook Live directly instead of using the medium that I'm using right now. But the only convenient thing is that when I use this medium, I can stream to multiple platforms because I'm also on YouTube right now. Where you say, mama? No, sir. So big things was going on today. At least, yes. At least, you know, you had it going on there too. Okay. So he said the big man flew in from London to Canada. That's what I'm talking about. Good night, Event Naturals, Massachusetts. Did I get it right? Massachusetts. Yes, is in the house. All my Event Natural boss ladies on a roping and calling on a crew. Because tonight I want to get your feedback. I want you guys to participate. Tell me if you had the experience. You know, we're going to talk the things and tonight we're going to be unfiltered. See, guys, all know I don't get my notifications. So help me send out the live, please, because that's how the algorithm works. If we don't share the live, then Facebook thinks that nothing is going on. So they just keep the live just dead and, you know, just stay so I'm not going anywhere. So share the live for me, guys, please, and thank you. I'm just waiting for others to join. I told you 9 o'clock. It's 9:06 Eastern Standard Time. So while we're waiting, I'm actually looking for my song that I normally play. But hey, I haven't done this in a while, guys, so I'm getting back into the groove. You guys, so please come on in, just be patient. We're waiting for others to join us tonight. And it looks like every music wipe out of my library. This don't make no sense, no so. Oh, Keisha, that's what I know her as. Exactly. Yes, Keish. Saw you today with your majesty. Okay, I gotta go check out that live. Actually, when I went back on Facebook, when I thought about you, I saw your live was just ending. So, later on I gotta watch it because you know how it goes. That's how we do. You know what I'm saying? Yes. So, guys, as you come on in, just relax, get your cup. Let me get my stuff, guys. Hold on 1 second. I'm sorry. Oopsie, I'm coming, guys. All right. I gotta go take my glass. Yeah, got my glass. Make sure you have your glass, guys. We're gonna be here for a little while tonight. All right. All right, come on in, guys. Come on in. Welcome. Come on, tap in authentically tonight. On my realists. Come on, Facebook. What are you doing? I have not even gotten any notification from my own page. Like, seriously? Wow, it's crazy. I refresh, nothing. Wow, that's crazy. Facebook, don't do me that. So what's going on, guys? Let's wrap a little bit while we wait on some others to join us. What's going on with you guys tonight? What's going on in your world? So Keisha said good things. Did I go on to Canada today with Mama? Chris Royal. Yeah, big up on herself. You don't know. Each one support the other. That's what we're talking about. Because, no matter what, I used to be selfish. I'm not going to lie. As a child growing up, I used to want it all for myself. I used to want to do it all by myself as well. So sometimes it's not just the want that we want it all for ourselves, but sometimes we think that we can do it all by ourselves, but sometimes we do need support from others because no man is an island, no man stands alone. You understand? So that's how the thing go. Support, Mama used to have one saying, say, hand go pocket come. Anybody know that saying? All right, guys, come on in. I'm waiting for some more people to join us now. 9:10. We'll give them like 5 more minutes. Please share the live. Tell everybody that we're live. For those who were on my previous live today, you know that we're starting at 9 p.m. tonight. So get comfortable. Tap in authentically, guys. Come on in. As you know, this show tonight, Saturday Night Live, we discuss thought-provoking conversations, mind-boggling conversations, guys. Conversations that are deemed sensitive. We discuss this on this show, and I'm not going to hold back. We're not going to hold back. We're not going to sugarcoat. We're just going to speak our minds respectfully. We're not here to disrespect. So please, guys, as you come on in, we respect each other and we hold each other accountable. And I don't know Cleopatra. She there, the all the boys and girls, and we need a teacher. Today I was giving them a little bit of my DJ skills, guys, yeah. Cleopatra, she there. For all the boys and girls, and we need a teacher. Number one sensible specialist in the area. She no follow, cause she done a leader. So you better come true on your best behavior. Behavior. I promised you guys that I wasn't gonna be late. She gonna make sure she not late for reach or just reality. From Cleopatra mind, reality she a deal with and she not act shy, I just reality. From Cleopatra mind, reality she a teach you and she not act shy. She come for teach you, not for beat you. She royal cause she loyal. Put her YouTube channel on your dial. It's a reality show real and not 30-day trial. She transparent, tell the truth and go check her profile. Sometimes she good, sometimes she wild. Boom. Yes, my child, I just reality. From Cleopatra mind, reality she a the hey, Shaba. Patra. You understand? Yeah, guys. To come for teacher, not for beat you. You understand? That's what we do here. In life, we have to be well-rounded. We can't just be on one level all the times. We have to be well-rounded, full of fire, vibrant, full of fire, fortified and diversified, guys. That's what I'm talking about. Now, if you're a real being and you want us to chat the real stuff, this is where you come. Follow me for the juice every Saturday. We talk real life situation, real life experiences, something that I have experienced, something that I see someone experience. Just come over here. We get the sauce, the secret, reality, positive vibes. Saturday nights in my royal space. I'm Royal Cleopatra in my royal space, live at 9 p.m. You guys chose the time, so we're working with your time. Whatever time you say, I can make it work. You understand? So sometimes we got to put the children off to bed and we just feel free, relax, and we'll come vibe, chat about it, that must say. All right, guys, so I'm going to start. It's 9:13, and for those of you who are here, let me start off by saying that my reason for being here tonight, I was calling out all the nurses, and I am calling out all the nurses, whether you are an LPN nurse, whether you are RN nurse, whether you're an associate RN nurse or a BSRN nurse, or you're a nurse practitioner, whether you're an old nurse, a retired nurse, a student who has just started, someone who's just graduated. I'm calling everybody. Please tag somebody. See, guys, I'm still waiting for my notification so I can send it out, and see Facebook not even notify me. I haven't gotten any notification. I haven't gotten it. Let me see. Because I'm waiting to send.
Guys, I'm still waiting for my notification so I can send it out.
Okay, so I just got it, guys. So I'm gonna share. I'm going to share to my WhatsApp group. All right, please help me to share this live out, guys. So I just got my notification. So I'm doing my due diligence so that others can join us and that we can have a good conversation over here. Okay, let's see. Post it in your groups, post it in your WhatsApp chat, guys. Please help me to get this word out tonight. We're going to have a decent conversation, all right? A very decent conversation. All right, let me post this on my regular page because I don't know I'm full of page and stuff so that others can see. And please tag somebody. All right, here we go. All right. Okay. All right. How do I tag somebody? Okay, myself. Okay, edit post. Tag people. Okay, so I'm going to tag a few people. All right. Tag people. We'll wake up everybody out of their bed tonight here. All right. So tag some people with me, guys, please. I'm just going to tag a few people. All right, so we're going to get into it now. There we go. So I got the notification. Thank God. All right. Yeah. So like I was saying earlier, that we got to be full of fire. And we got to be not afraid when we think of something that could benefit someone else and we have the platform. Use the platform. We all have a voice. Don't be silent. Don't let anyone silence you. As long as you're not tearing down someone or you're not trying to dismantle another person's livelihood, come and speak, share your story, share your experience. Come learn something. Speak about what you're experiencing and see if someone has a better solution, or if you have a solution that you can put forward that someone can utilize to make their lives or their loved one lives better lives. All right, guys? So that's what we're about here. All right, so like I was saying, I'm calling all nurses tonight, everybody, as a matter of fact, but mostly my nurses, because I want to see what the feedback is like from other like-minded professional nurses like myself. I am a nurse, guys. I am also an international chaplain and international anger management specialist. I'm also a domestic violence coach, being that I'm also a domestic violence victor. I'm not a victim anymore, and that I can come out and I can boldly share my story so that other women who feels inferior and feel like they're worthless and unworthy know that, listen, we've all gone through some sort of abuse and we got to shake it off, know ourselves, know who we are, and know that we're worthy and that we're winners and we know when to walk away from any adverse situation. But tonight, we're not going to talk about domestic violence. We're going to talk about knowing your rights and your obligations as a nurse. And let me start off by saying this. Before I even became a nurse, I've had the opportunity to work in a hospital setting for 3 years as a public safety officer, where I worked alongside patients and staff very closely. And I've seen so many things. And I also had loved ones, for example, my grandmother, who was in the hospital for a good while. And we've seen some things and we've asked ourselves questions and want to know that our loved ones, when you have a loved one who is ill, who is in the hospital, you want to know that your loved one is getting the best care, whether in a facility and like a nursing home or a hospital setting. You want to feel good in yourself knowing that you can leave your loved one for the night or for a couple of days and that they're getting the best care possible. Now, how would you feel to know if you or your loved one is in a setting where you need the service of a nurse and you're getting an attitude from the nurse as if, she doesn't want to be bothered with you? For example, you may be going through pain, feeling pain, and the nurse doesn't take you serious, and she is coming and tell her that, oh, you're such a pain in the man, or we're dealing with a difficult staff. How would you feel if you are labeled as a difficult patient by a nurse? I would like to know, how would you feel? Because in essence, we have to first understand that everybody's pain level is different. Your pain level is different from mine. My pain level is different from yours. And so we have to understand our patient's background, our patient's culture, our patient's tolerance before we label our patients. As nurses, we're not supposed to be judgmental. Okay, we have to make sure that safety in any job, as a matter of fact, safety comes first. You will always hear that safety comes first. And one would ask me, why did I decide to become a nurse? Of course, I decided to become a nurse for more than one reason. And one of the main reasons why I decided to become a nurse is so that I could be there for others to provide quality services, because I've seen where people go in and they get crappy services, they get bad treatment. And we're not here to talk about all negative tonight. I'm just going to use some negative to turn them into positive tonight, okay? And see how best we can do things the right way. Sometimes I'm sure you've heard nurses, you have friends who are nurses, and they tell you that they feel like they're burnt out. They feel stressed. Why is it that they're stressed? Why is it they're burnt out? Some people, they join the field because of the money. And this is America. They will tell you nursing field is the field to go in. Why? Why do we want to become nurses? What's the first question you ask yourself? Why do you want to become a nurse? Is it because that's where everybody is going these days? Is it because of the money? Is it because of your love and passion for people? Or is it because of some other reason why you decide to become a nurse? That's the first thing. All right. As I've said earlier, for me, I have passion for people. I want to be there for people, because sometimes you find that you have patients who they don't have any family member and they just need someone to have therapeutic conversations with. And with that being said, they become calm, stable, knowing that someone is listening to them. So, that's as one of the skills as a nurse, you have to be a very attentive listener. Sometimes you got to be silent and let them express themselves so you can better even understand your patient, and just to let them feel that they're heard. Just that can start a healing process for a patient. Now, from my experience, I've seen some things in nursing, and I'm not trying to bash the profession. Don't get me wrong, guys. But some things I always like to highlight, especially when it may be considered sensitive or touchy. Nobody wants to speak about it because they feel that if they speak about it, they're going to get backlash. People are going to come at them. But hey, somebody has to speak about it. Now, some of the things that I've seen is that as a nurse, you go into a job, you apply for a job, and you get accepted, you accept the job, and I'm sure they are looking for people who will provide service to their patient populace. And that is what you're there for. Now, let's say you go into your job one day, you're going for a 12-hour shift or an 8-hour shift, whatever hour shift you're going for. You love your job and you go in. And you find that you have let's say normally you have 10 patients, which, sometimes it can be more than that. And you go in on this particular day and you find that you have 2 or 3 more new patients. You find that based on the patient's needs, you have out of that 13 patients, 3 patients who are on oxygen. You have another 2 patients who are on PEG tube. You have another 1 or 2 patients who are at fall risk. So they have these alarms on their beds or chairs where if they get up, that kind of alerts. So you hear all these alarms going off. You hear all these sounds blaring. Now, what would you do? You go in for your shift. And I'm speaking to the nurses who are listening, or people who understand nursing. So you're going for the shift. The protocol is that you go in, you do your rounds, you get your report, and you check off some things and you start working, right? That's the norm. However, you go in this particular day, you have more than the norm patient ratio per se. Normally you'd have, say, 10 patients, you have an extra 3 patients, but then you realize that, okay, those 3 patients who came in, they're IV patients or they're oxygen patients, they're very critical. Now, it depends on the nurse's level, because, LPNs are different from RNs as it relates to your scope of practice. So what I would say, the first thing you should understand as a nurse when you get in the field is to know your scope of practice. What is that? I'm sure we learned that in fundamental nursing. You have to know what you can do from what you're not allowed to do. And remember, the most important thing is that the scope of practice or nursing act, it's different as we go state to state. Every state has their own rules, policies, procedures as it relates to this field, this profession called nursing. So I'm in Florida. So the first thing I would try to find out, what is my scope of practice as an LPN? I'm studying to become an RN, but as an LPN, as it is right now, what is my scope of practice? Now, I've seen you go into a job and you're given a job description, okay? They hire you because they need people. And then when you start working now and you get an assignment, which you, the nurse, knows that it is out of your scope to do, and it is unethical and illegal to do something that is not within your scope, because at the end of the day, you are going to be the one who's going to be put on spot, not your employer. And at the end of the day, when you're put on the spot or even get caught, everybody's going to act like they don't know you. All right? Am I telling the truth or not? I'm sure you guys have heard stories, I've seen incidences, right? And so forth. So you go in, you get your assignment, and you're being told that, oh, as a nurse, you should be able to do this. As a nurse, you should be able to do that. Do not let anybody intimidate you. Do not let anybody frighten you. You are the nurse and you are in command of your job at the same time. So first of all, you should know your limitations. You should know the depth of your knowledge of the job. You should know a little bit about the place that you decide to work for. Is it a norm for them to lack resources? Is it a norm for them to have a high turnover rate? Why do they have a high turnover rate? Do they normally lack resources? Because remember, in nursing, you have to make sure that you have your tools to work with. It's very important because you're dealing with life and death situations in this case. And like I said, the first thing when you're dealing with your patients, safety comes first over everything else. Safety comes first. And a lot of nurses believe that, oh, I am in this profession and I can do this as a nurse. I'm told that as a nurse, I should be able to do this and I should be able to do that. And oh, why are we here for? We're here supposed to be taking care of the patient. I want you guys to stop and think about this first. Like I said from the get-go, some of us, we come into the profession for various different reasons. Some of us, it's just for the money. So for the ones who come in for the money, I'm sure they will jump up and take the job, 32 patients, one nurse to 32 patients with only probably one CNA or two CNA. Think about the chaos that can happen. Think about the different level of needs that those 32 patients, and I'm speaking of experience. You have 32 patients. You have so many patients who are on oxygen, so many patients who are on IV, so many patients that are on JPEG feeding, so many patients who are diabetic, who they may have an episode of hypoglycemia, which is low blood sugar, or hyperglycemia, which is high blood sugar. You know, those are very critical situations to deal with. So out of that 32 patients to one nurse, think about the acuity or the severity of each patient and their needs and wants. Okay? In this case, you're going to have to be thinking about what is urgent and important, then what is urgent, then what is important, and then what is not so urgent, what is not so important. That's how I do my task so that I can, without having to be like running without a chicken without a head, I can, go about my daily basis not feeling overwhelmed or overly stressed. But some of the times we have to back up. We have to know when to draw the line, and we have to know when to refuse an assignment. So this is the meat of the matter of this subject matter today, this conversation. Can a nurse refuse an assignment? That's a big question. Because a lot of times we get this misconstrued, we get it misunderstood, that a refusal of an assignment or refusing a patient's assignment means that you are abandoning a patient. That is incorrect. And that is why I'm here tonight to speak about this refusal of assignment. A nurse has a right. Nurses have rights and nurses have obligations. And it does not mean that when a nurse is refusing an assignment, it doesn't mean that the nurse is abandoning the patient. So I'm going to explain the difference tonight, and I want you to also share your experiences with me. Just 1 second, guys. I'm trying to share this live with some people. Bear with me, guys. Yeah. Hold on, guys. Hold on. All right. It doesn't mean that you're abandoning the patient. So I'm going to teach you the process. If you're a nurse, if you're a new nurse, student, old nurse, because sometimes it doesn't mean that because a nurse is in the profession for 20, 30 years mean that they know these things, because they're so used to their superiors, their supervisors, and their managers telling that, oh, as a nurse, you should be able to do this. And as a nurse, you should be doing this. It doesn't work like that all the times. And if you want to make sure that your loved ones get the best care when they're not around you, if they have to be in the hospital or if they have to be in a nursing home, you want to make sure that these are the things that are happening. So you, if even you are not a nurse and you're listening tonight, you're going to learn something, because then it's going to give you, open your mind to ask questions when you go to these places that your loved ones are being treated or being taken care of. So again, that is the reason why I am here tonight to discuss this topic. Like I said, a lot of people don't want to touch it because they're like, oh, so if everybody's going to refuse an assignment, it's not about everybody refusing an assignment, because you have to know when to refuse an assignment. You're not going to get up every day and just refusing an assignment. No, you're going to have a very valid reason why you are refusing an assignment. And a lot of people do not know that the American Nurse Association, which is ANA, it backs you when it comes on to knowing your rights and your obligation as a nurse. So you guys must know that patient safety comes first. The American Nurses Association, it holds nurses based on their profession and ethical responsibilities, right? To have the professional right to accept you as a nurse based on the American Nurses Association. You as a nurse, you have the right to accept, to reject, or even object in writing as well to any patient assignment that puts your patients, not only you, but also your patients themselves, at serious risk, and even you, putting you at risk of even losing your license. Now, you tell me, you work hard for your license, you just want to put it out there just like that to lose your license? No, you don't. As I said, some of us nurses, we will do anything for the money, and we will complain same way, under our breath same way, and we will do anything for position just because we want to say we want to be charge nurses, we want to be nurses who are in command. No, don't risk your license. Do not jeopardize your license. Do not put your license, which is your livelihood, at risk. I'm sharing this with you. I am sharing my experience in a way where I can come and speak about it without putting anybody on the spot tonight, because I think this is something that needs to be highlighted. You have a right as a nurse, and you have certain obligations. Your concerns for your patients regarding your patient assignment, you're not going to put your patient at any risk, or you're not going to put yourself at any harm or any risk for harm at all. And again, you have the American Nurses Association that backs you on that. So how do you refuse any unsafe patient assignment as a nurse? That's a big question. I'm sure you want to ask me that question, right? You want to ask me that question tonight. Since COVID, most places are short-staffed, so the nurses have more patients. Artio, there you go. There you go, Ziven Naturals, Massachusetts. And not only that, we find that because of COVID, a lot of nurses are staying away because they don't want to catch COVID. And a lot of places are asking for, that proof of what. And some people, they're not doing it. And some people, they're holding steadfast, not even with a waiver. They will not accept you as a nurse if you don't have that thing. And then some of the nurses are also migrating as travel nurses for bigger money. So you find that the other little places and the places with the more technical assignments, they're getting left behind. So what are these places? That's one other thing I wanted to talk about. So what are these other places who are short-staffed? What are they planning on doing to implement measures in place to get back some of these nurses to come back and work for them? They have to go back to the drawing board. So a lot of them also got funding from the federal government to pay people more. So that's one thing they can look at. You understand? And a lot of nurses don't know that. So that is why when you are going, if you know that you're not going to work for X amount, do not take the job and then complain. Because at the end of the day, you're only going to provide less service for the clients or patients, and people's loved ones are not going to get the best care. And I'm telling you this. I'm not trying to put anybody out there, but I'm telling you that it will happen, and it is happening. And sometimes it irks me, and sometimes I want to talk the talk, and sometimes I do speak the talk. And when I do speak out, a lot of the management, they don't like me for that. But guess what? It is what it is. Somebody has to speak out. And being an advocate, I will always speak when it is right. As long as it's a right time for me to speak out, I will not hold back. I will first speak up for myself, and I will also advocate for my patients, because one of the qualities as a nurse or skill that you should have is to be non-judgmental and also be an advocate for your patients in every way. Whether you're going to speak to the doctor on the patient's behalf, or you're going to speak to your bosses on the patient's behalf, you as a nurse has to be an advocate for your patients. All right. So if you're not a nurse, that's something you would know, that the nurses, they have the right to be an advocate for your loved ones who is their patient or client. Now, what are these places going to do to cause nurses to come in? Because of course we have a lot of people, like I mentioned in the get-go, turning to nursing because of the money. Of course, not only the money, but I'm sure some of them genuinely doing it because they want to be there for people, to provide empathetic care, compassionate care, and quality care, because they probably had a loved one who had never had the care, never gotten the care that they needed, and they passed away, and they've seen it, and they want to make a change in this world for somebody else's loved one. But the money, we need the money too, because cost of living is going up. So definitely we need the money. But you have some people, definitely they're just going it because of the money and nothing else. And they will take on the job and act like they're heroes and not doing the job properly, shortchanging the patients. And we don't want that. We don't want that. I have seen it. We don't want any more of that, because sometimes you find patients die when they could live a little longer. Am I speaking the truth here or nay? Speak the truth and shame the devil. That's what I know. Understand? So, okay, I was in the hospital setting where it's live, like 4 to 6 patients to 1 nurse. Right. In the hospital, you'll find that, but in the facilities, you'll find 1 nurse. I, as a new nurse, let me share one of my experiences with you. As a new nurse, you'll hear them tell you that, oh, we're only giving you 3 days orientation. You can voice your opinion. You can voice your voice and say, no, 3 days is not sufficient for me. I'm a new nurse. I'm just coming out of school. For me personally, I didn't have a lot of hands-on clinical because of COVID. I had to do a lot of clinical online called assimilation. When you don't get hands-on, it's called assimilation. So for me, I never had the opportunity of delving with hands-on. Once COVID stepped in March of 2020, I was still in nursing school. I did not have the chance to get hands-on and dive in and do physically. So going into these, my first job was in a facility. And I remember I was told I was supposed to be getting training for 1 entire month. Can I tell you something, guys? I only got 1 week of training. I started the Tuesday, and by the next Wednesday, which is 1 full week, the person who was training me called out, and guess what? I was left with 32 patients. But being a new nurse, I never tried to know how I could have refused certain assignments. I'm there and thinking that, oh, I had to do the assignments and to take care of these 32 patients. Now, what if something had happened? I could have lost my license there and then. And I'm not being negative. I'm just showing you. I was limited with knowledge. My skills were limited. And they just chucked 32 patients on me and tell me that, oh, this is how this place runs. And a lot of nurses would probably disagree with me and be like, oh, you better get with it. What we learn in nursing school is not the same in the real world. But if that's the case, my question to you nurses who would want to say that to me is, if that is the case and it's not so in the real world, why when they have state comes to these facilities, everybody gets jumped on and things that were missing and what were needed, everything is in place and we have to do it how state recommendation is, if that's the case. So that highly said, good night, my dear. Yeah, man, you understand? So I would ask them if it's not so, because me personally, I like to work by the book. So when I'm getting trained, I like whoever's training me, please teach me the right way so that if state should come, I'm not running around like a chicken without a head. I'm not having to be nervous, even though we still get little butterflies if someone is over you at times, but it makes you more confident when you're trained the right way, One thing I learned when I was doing marketing, and I try to apply it in all my everyday living, is to get it right the first time, all the times. That is called total quality management, TQM. Get it right the first time, all the times. So when I would say to them, teach me the right way, just in case if state should come, especially for me, I had worked on the day shift in that facility. I want to know that if state comes and come to me, I can, safely answer any question, or I can feel confident knowing that what I'm doing is state's recommendation. You have a lot of people, them cut corner, and I'm sure you have to cut corner sometimes to make the workload get done within the number of hours that you're assigned. But my thing is this, if it can't happen, then you have to voice. And then that's where refusal of assignment come into place. One thing that I want to point out, I'll put a disclaimer out here, is that if you're going to refuse an assignment, do not do it after you accept the shift. Meaning that you go in, you get report from the previous nurse who is coming off shift. If you get the report and then accept the assignment, then afterwards you're refusing, that is where abandonment comes in. One time, nurses used to get away with a lot of stuff, but I want to tell you guys today, if you're a new nurse, please listen keenly. They're not playing with nurses anymore. Just recently, last week, 2 nurses here, I think in Florida, were sentenced in prison for abandonment. And one would say, oh, the shortage of nurse, you're sorry for them, but they must know their rights and their obligations. And that is the reason why I choose to come out here tonight and speak about nurses' rights and obligations, because a lot of our nurse peers will tell us that, oh, boy, you have to do this and you have to do that. No, no make nobody tell you that. You have the honor who will back you, which is the American Nurses Association. They tell you that you as a nurse, especially registered nurses, you as a nurse, you have a right and obligation to accept, refuse any patient assignment, and you have to make sure that your refusal is a valid one. So you can't just, like I said, you can't just refuse an assignment because you want to refuse an assignment. Because, for example, let me give you a scenario. For me, I had a situation where I was assigned 5 patients. One of the patients was a COVID positive patient, and 4 of them are considered non-positive, so they're clean. Now, any nurse on here, I want to ask you this question. If you have a so-called dirty patient and you have 4 other clean patients, what would be your method of getting by your day's assignment? How I know it is that I go from clean to dirty. So when I got this COVID patient, I refused the assignment. In my work at the time doing home health, I refused that assignment. And I refused it on the notion that, look, number 1, I am not whatever. Number 2, I am going to have 4 clean patients to deal with. So I was told that, oh, unfortunately, you're going to have to see, or we, the company, I can't call names, we have to see all patients. Remember now, again, you have to know your rights, know your obligations. So I turned to the supervisor and I said, unfortunately, I'm refusing this assignment, because unless you're going to tell me how to proceed, let's say if I have to see that patient first, how am I going to proceed to take care of the other non-positive patients? Because my concern is that I am going to be exposed dealing with this positive patient, and going forward to deal with these other 4 patients, I'm going to put them at some sort of risk of exposure. Because like I said to them, and they called me up in a meeting, and I was like, I'm not backing down, because I don't care how much done and duff we done and duff. The fact is, we've seen many healthcare workers contracted this virus. Many of them were exposed, contracted the virus, and many even died. You understand what I'm saying? And we're speaking about healthcare workers in the nursing field right now. And I said, not even the CDC knows how this thing is contracted. This thing is not a contaminated thing where, it's blood, and if I touch you and you have some opening, you can, it can be transmitted. It's a virus. We don't even know how it's contracted. You understand what I'm saying? And I'm saying that if I didn't know my rights, then they would trample on me. And when I finished speaking with them, you could hear a pin drop. Now, if I didn't know how to advocate for myself, then they would have me doing something that's unethical, because me going to my other clean patients, I feel like it's my duty to let them know that, listen, I was at risk, or I was at risk of exposure to the virus. So me coming here I'm gonna put you at some sort of risk. Because at the end of the day, what if those clean patients found out that I had a dirty patient? When I say dirty patient, positive patient, right? I don't want to say that much here. And they found out that their loved one got it because of me being exposed over there, bringing it over there to them. You know whose license is gonna be at risk? Mine. And you know who's going to act like they don't know me? Those people above me. All right? So what I'm trying to say, again, I'll keep going back. Know your rights. Know when to refuse an assignment. Ask yourself certain questions. Know about the establishment that you're working. Know what they're good for. Know what their trend is. Know when to refuse a nursing assignment. Like I said, you have a right. You have a right to make sure that your patient is safe, and you have a right to make sure that you, as a nurse profession, is also safe. Again, you have the necessary bodies to back you. A lot of people will go into certain professions, and the first thing, like I said, all we worry about is getting paid. We don't worry about the benefits. We don't find out what our full benefits are. We don't find out what the policy and procedures are, because even though a certain job may be within my scope here in Florida, every nursing job or organization that you go to, they have their own sets of policy and procedures. So even though my scope can say, okay, as a LPN, I am able to do to start an IV because I'm IV certified, because I am IV certified, and not all LPNs are IV certified. That is something that you have to do on your own. But I also, when I finished nursing school, I went ahead and got myself certified, knowing how to do IVs and start IVs and all of that, right? Now, you can also get certified in wound care. So the fact is, even though it may be under your scope, you still have to find out wherever you're working, what are the rules and policies. And you have to understand that a facility may run different from a hospital. A hospital may run different from a nursing home. A skilled nursing home may run different from an assisted living or an independent home. So you have to know all areas, because why am I saying this is that even though as a nurse, because again, you'll hear them hammer in your head, oh, as a nurse, you should be able to do a catheter. As a nurse, you should be able to start an IV. Oh, as a nurse, you should be able to change this. As a nurse, no. What is your policy and procedures? Is it that an RN does certain things in your organization versus an LPN doing certain things in your area? And let me also say this to the LPNs, because I'm an LPN and I'm voting much for the LPNs tonight. One of the things that you learn or should know is that as an LPN, when you have a number of patients, and let's say the RN is delegating some of the work to you, because I'm sure you hear this saying when you go to work, is that young eat their young, something like that. I remember when I first started working this year, March, I heard that and I didn't understand what it meant. If somebody knows the saying, just drop it in the comments for me. And they said young eat their young, whatever it is. And the RNs, they will give you the worst assignments. You notice I didn't say worst patients, because I don't try to classify my patients as anything negative, because first, as a nurse, you should not be judgmental. You should find out your patient's background, your patient's culture, and then you will know how to deal with them. You should never, any nurse at all, you should never label your patients, or when you feel like they are such a whatever. Because what I have found out is that it depends on your approach to this patient or client. Everything depends on our approach. But let me get back. I don't want to get sidetracked. Is that some of these RNs, they will put down the workload on you and give you the heaviest and the hardest work to do. And as an LPN, if you're listening to me, whether right now or you're going to listen to this live, know that as an LPN, you are supposed to get the clients or patients with the less acuity, less severity, less complexity. I'm teaching you something that normally nobody wants to teach you, or you don't have the time to find out because you're not interested in that. It is important. Ain't nobody gonna come give me the hardest work when I'm just a LPN, when I know by the law and policy that I am supposed. And let me give you an example. I love that you say how your patient, things we sell cheaper. Hi, welcome. Thank you so much. Hi, good night, Cynthia. Good information, nurse. Thank you. You know, that's why I'm here. I don't know it all, but like I said, I come with my experience. And when I go through something, if I have an experience and I'm not sure, I either call the Florida Board of Nursing and I go to the source. I go to the source, because ain't nobody going to take me for a fool, and ain't no nurse friend going to tell me that, Cleo, you know, why did you become a nurse? You should know as a nurse. No. It doesn't work like that, because you should also know that as a nurse, you should have your rights and your obligations, because at the end of the day, safety comes first for everybody. And I'm not putting listen, when I was getting my license, I looked like a zombie for days. I was crying night in, night out, morning in, morning out. My big old 3-year-old son a suck titty same way and him up with me in the morning when him should have sleep and me a ball because I'm stressed. Me not have nobody to help me with them. Me not have nobody to help me do my chores. Me not have nobody to help me pay the bills because I was going full time. So listen, I know how hard I worked for my license. So guess what? Ain't nobody gonna take this girl for a fool. No way, no how, Jose. No. And I have a voice and I know what is right. I'm going to speak up. I'm sorry. I am sorry. I'm sorry. I'm going to do it the right way. All right. So that's why we have this discussion because, like I said, a lot of people will disagree with me, but it's okay. I just tell my daughter to listen. Thank you so much, listen. Like I said, calling Jackie, if I send the live to you, I think, Jackie, let me send it to her because her daughter just graduated too. 1 second, guys. Hold on 1 second, guys. I gotta, like I said, call in all nurses, call them in, and them want to talk to because I want to hear their voice as well, what they think about what I'm saying. If what I'm saying is not so, then you can correct me. And or go find out because, like I said, a nurse could be in this profession for 30, 40 years and don't know enough of this that I'm speaking about because they're just in it for whatever reason and they just want to go to work and they just want to get the money or they just want to go home or they were always told that, oh, as a nurse, you're supposed to do this. Doesn't work like that. So let's get into the meat of the matter. When to refuse a nursing assignment. Like I said, you can't just get up and refuse an assignment. And like I said, before you do any refusal, make sure that you don't take any reports. If you take that report from that previous nurse, again, let me stress that, and you accept the assignment, whether you're grumbling or complaining, Lord, 32 patients, then give me this week, how much patient, how many I got to do this, and no. If you don't provide service after you take it, whether you're grumbling or not, that's where abandonment gonna come in and you're gonna get arrested and you're gonna go to prison for that. And I don't want any of my friends to go to prison for abandonment. So that's why I'm giving you the nuggets. I'm edifying you. If you know already, that's okay. And if you don't know, here we go. Come for the juice, come for the sauce, come for the secret. So here are some of the reasons you would refuse an assignment. Let's say, because sometimes we float, because some of us, we do full-time one place, because we have our 2-3 job, and I know the Caribbean people, them go already, especially Jamaicans, we have our 5 job. So you're working somewhere full-time, but you float somewhere else, per diem, or you just being a floater at a particular job. Or being a floater, you go to a place, everything is going to be unfamiliar with you because you don't know, you're not there on an everyday basis to know how the place run. So you go there. So even though you're a nurse and you should know everything according to the bosses and on a set work. So you're unfamiliar with the clinical area. That's one thing. But what if you were ordered to perform an unfamiliar procedure? Think about it. What if you were ordered to perform an unfamiliar, meaning that you have no idea? Because one thing a lot of these supervisors and managers don't understand, or they tend not to want to understand, because as long as them look good and as long as them are the boss and them are make them money, they don't care about you. I want you to know that they don't care about you. They take for granted that every nurse knows how to do everything that is under their scope. That's not true. I gave you a perfect example with me. I did not get a lot of hands-on clinical. So I had to do a lot of computer clinical assimilations. Okay, so I just had theory. I could safely say that I just had theory mostly. The most percentage for me was theory. Okay? And even if, like how I got certified in IV, I was told, I loved my teachers. I still love them to date, and I still keep in touch with them, especially my administrator, because the other day when I was going through some stuff with this workplace and me and them, and I give it to them, and I call my administrator and I say, I want to know if I'm going wrong. And she said, Cleopatra, she listened to me, and I told her where I thought I went wrong, and if I had gotten out of line a little bit, and I told her the truth. She said, you did nothing wrong. You worked within your scope, you followed their policy procedure. It was just their poor management. Anyways, like for me, I'm given an IV, even though I'm IV certified. What you need to know, If you go on a job and you've never physically done an IV in the real world setting, you ought to let them teach you or guide you. So even if though I'm IV certified and I go to a workplace right now, I still let them teach me. I said, look, I would rather you teach me or have an RN perform it the first time, and then the second and third time, I still need an RN to supervise me. Because I want you to know this, any little mistake that you make, any little error that you make, just remember who is going to be in fire. You just remember who is going to be in fire. Not the RN, you. Not your supervisor or the unit manager, you. Not the team manager or the DON or the assistant DON, you. Any error that's made. You ever hear about med error? Listen, when I just started working, guys, because I'm sharing this with you, my first week, new nurse and new to the job. And I know nobody not gonna like that. What I do, I observe a lot and I asked a lot of questions. But to them, it was like a pain in the main. But for me, what I've learned, if you don't understand and you don't know, it's better to open your mouth and ask questions. No question is a dumb question. Okay? No make nobody fool you. And let me tell you this, I saw so many medication errors. I'm going to share some of them. Medication errors, for example, a patient is supposed to get metoprolol tartrate. So you have metoprolol tartrate and you have metoprolol sucralfate. So they're both hypertension or high blood pressure medication. Both of them are high blood pressure medication, but they do different things. All right. So I'm going to stick to metoprolol tartrate. So you may have a 25 gram and you may have a 50 gram. You may have a 50 gram saying give half. That's why I say pharmacology is very important. That's why if you're not past pharmacology, no feel no way up to school, no make you go on, because pharmacology is very, very crucial, very important. You have to know how to calculate and you have to have a keen eye when it comes to medication. One little ounce of something over, especially all insulin, you can kill somebody. Okay, it's very important. So don't take anything for granted. It better you take your time and take forever and get it right and know so you do it right. Because remember, even with medication, you have to make sure it's the right patient, it's the right medication, it's the right dosage, it's the right time, it's the right route, because it may be that that patient is NPO, meaning that they can't take anything by mouth, and you go get the person something by mouth when they're supposed to get it by a JPEG tube, and you never realize say the patient have a JPEG tube because the nurse before was trying to rush to go home and she didn't give you the full report. You have to know your rights and your obligations. All right. So let me go back to the story now. So you have the metoprolol tartrate 25 grams. So when we look, I realize, because me is a detailed person, so me going with my detailed self now and me and make sure say it was a new patient who was just admitted. No, me just even find out this recently after the fact that as a new nurse, me shouldn't even been given no assignment with no new admission or no discharge, because remember, I'm limited. I'm considered limited edition, so to speak. So I'm limited to information. I'm new to this. And I need more training and guidance than anything else. So the first week me going, like I said, them lick me with 32 patients after the first week of training. That's my training done. A 1 month of training, them promised me, and a 1 week me get. And after the first week, me lick with 32 patients. So when me look, my sister, the medication no match. So I go for the file and I'm looking and I'm matching. I'm go to one of the older nurse and she's like, girl, just do it. I'm like, what? Just do it. I'm like, no, I can't do this. I said, this is called med error. You know the charges for med error? People go to prison for med error. So I brought it to the DON's attention, and she's like, she brought me back to the nurse and said, don't you ever do this again. She's correct. She's a new nurse. Listen to her and feel good enough, but that's beside the point. I'm just showing you where just one little error, you have to make sure that your patient are getting the right medication, because you taking on the assignment knowing very well that it's going to be strenuous on you, but you take it because you don't want to look bad. You take it because you don't want to be the rebellious one, quote unquote, labeled the rebellious one. You take it because you want to show off. You take it because you want position. Now do it, because you have put the patient and the people's loved ones at risk. Stop doing it. You know how many times I see me go in a patient room when I'm my shift, see all peeling at the patient, then bed, and ask the patient, say, if I them turn on them and say, oh, I was sleeping last night. I don't know. Nobody said anything to me about the medication. These things happen because nurses are burnt out and them take the job because them feel like people are going to fire them if them talk up, and them feel like people are going to look down upon them and have them up if them talk up. But listen, when you know your rights, you don't care. You're doing the right thing because you're making sure that your patients are not at risk and they're getting the best care, and that you are not going to be burnt out at the end of the day. Sorry if that organization don't have enough nurses. That's their prerogative to figure it out, how to get nurses to come in and also how to get nurses to stay. Because that's one of the things. A lot of these places, they have very high turnover rate because nobody cares. Everybody just come in and they do what they like, and nobody is holding anyone accountable or responsible. When your ear says state is coming in, you see everybody a buck shuffle and everybody a jump up and everything, that you couldn't even get one oxygen tank to provide oxygen for an emergency. You couldn't find the cups that needed to put the medication, the different medications in. Everything come to play and come in handy when state is there. And like I told one of my friends one time, I had a situation and I called one of my friends and I say, you know, I don't feel safe about this. And she's like, oh, so why? You're not gonna last long in nursing. I say, a liar. I tell the devil is a liar. I cancel those words and I send it back to the pit of hell. I will be in this profession because that's how God sent me, and him are gonna take me out. You understand? And oh, I've been a church nurse and I've been a nurse this and a nurse that. Me say that are you, and you know very well say, and I said supposed to go, because if you're gonna tell me that I'm not gonna last long because I'm trying to do it the right way, then if it doesn't work like this in the real world, which we always hear, then why when state come wanna do it the right way? That's what I want to know. Why when state come we do it the right way? Aren't we supposed to be striving to do it the right way all the time? So what if I'm that nurse who work by the books? You can't knock me. I'm just one of the nurses who work by the books. Because for one, you're not supposed to even take another patient's medication to give it to another patient, even if it's the exact same medication, exact same dosage, and because that patient run out, you're not supposed to do it. Some of these things we don't need to know, because at the end of the day, you'll find that when that other patient's medication run out and I choose to request it from the pharmacy, you know what the pharmacy is going to tell me? It's too soon to place the order. And then that patient end up get left where they need them hypertension medication, which is very critical. And then guess what? We find things happening. I'm speaking loud since. Yes, me I talk loud, so who not like it? Guess what? Nobody can bash me, because when me I talk is true. Me not call nobody name, but I'm speaking the truth up in here. You understand what I'm saying? I have to. Because these things happen on a daily basis. And I remember when my grandmother was in the hospital and I remember I left from Illinois and moved to New York, and when the doctors gave her some days to live, she requested to see me. And at the same time I get the message, I book a flight and I fly over from New York to Illinois. And when I come and I saw some things, and that time I didn't know nothing about nursing. You understand? And then I never know, remember say, me did say me want to become a nurse as a child, and even knew that I would become a nurse in the future. And I was asking a lot of questions, just the fact that, common sense. I saw some things, and, there's a thing called a call bell. And as I said, somebody may be in pain and they keep calling the bell, and the nurse will get, every minute she call. You don't know. And not everybody a cry wolf. They're just in pain and they need assistance. Sometimes they don't know what to do, and that's the only thing they know to do is to press the call button. So not because you have 30 other patients where you should have reject some of them means that you're not going to give my loved one the service that they need. That's what I'm talking about. That's why I'm here sitting down today chit-chatting with you guys. Reality, real life experiences, real life situations. And I know a lot of my nurse friends going to knock me, but I'm sorry. I have to speak. As a viewer would say, speak loud, and I'm speaking loudly. I'm sorry. I was reprimanded recently because I rejected an assignment, and they could not do me anything because at the end of the day, they know that I was correct. But they tried me. I had to literally, verbally tell them that, look, I'm not by the least intimidated by you, and you're not gonna bully me. I told them frankly, with respect. I say, you're not gonna bully me, and you're not going to intimidate me. Because you know better. As the head, you know way better. So you shouldn't even be coming to me with that argument. But as a new nurse too, they will try you. They will ask you to do unethical stuff, and you as the fool will jump and do it. Anybody here in Florida know about that? I'll use that very plain example with that facility, that how many nurses got arrested and charged and got imprisoned. That place that the residents were without air conditioner. Anybody heard about it? And I heard that, what I've heard, I don't know, it is alleged that some of the workers called the boss, and the boss said, just open the windows. Don't let nobody tell you that. You know better, do better. Who get caught at the end? Where's the boss? The boss, we don't know, but who got caught at the end? Whose license got taken away at the end? Whose livelihood? Whose children are suffering at the end of the day? Yours. Not anybody else's, yours. So you have to think deeply about these things. So let me get into it, because as I say, I come to give you information, I come to feed you today. Yes. So going back to the unfamiliar assignment, you're not familiar with this facility because you only work there part-time. You only work there in a blues, once in a blues, and you get in tasks that are outside of your scope, your nursing practice. And one thing, let me just jump this in as I remember. Also know your nursing act. That is one of the first things you will learn as a nurse. Know the nursing act and know your scope, because every state differs. And also know the facility or the place that you're working with. Know their policies and procedures, because not because something is within your scope, they have their own policy and procedures, and sometimes they want to step over bound with you. Okay, so just know that. So think about it. Are there too many patients or too little staff? I saw somebody typed in the chat earlier that because of the pandemic, a lot of places are understaffed. So think about it. Ask the question, are there too many patients with too little staff? What are the standard scenario at most of these places today? Which we can safely say that most of these places are understaffed for one or more reasons, okay? What is the setting in the floating setting, right? For these floating assignments, sometimes you have faulty assignments. And these assignments are issued with little regard to nurses' experience or inexperience, right? To nurses' lack of training or to nurses' training. So what am I saying? That they don't care what amount of training you get. Like I said, some of them will tell you only get 1 day training. Really? Someone you take from a different department and put them in ICU. Let's use that. We know ICU is a critical department. Someone you're going to take them from, because you're short staffed, you're going to pull someone from a different department just because they are a nurse, and a nurse should be doing everything according to you. You take that person from the other department and you put them in the ICU unit. They're unfamiliar with this setting. You know how fast-paced ICU unit and how accurate ICU unit must be and is. You have the poor nurse going in, she's supposed to look on and I say, what is going on in here? She's going to be lacking experience in that department. Okay? Are you concerned about the patient? Are you concerned about the nurse? Do you have any regard for this nurse? These are questions that you yourself need to ask yourself. Okay? It can be a very frightening position and experience for a nurse who's never worked in ICU before, but you're being told that, oh, you have to. No, you don't. You can speak up and say, you know what? Unfortunately, I have little to no experience in this department, and I don't feel safe that I can provide safe service to these clients. You can speak and refuse that assignment. On that notion, you can refuse that assignment because of your little knowledge in that department and your inexperience in that department. You can refuse that assignment. Yes, you can. So don't let anybody fool you. Being ordered. We are so used to being ordered to perform unfamiliar tasks and procedures which are also outside of our scope. For example, LPNs versus RNs. So you may find that they have more LPNs than the RNs in that particular scenario. So normally, certain places only RNs can go do a particular visit, especially if it's like a home health setting, you know, and the LPNs are only assigned to do certain tasks. So let's say they're short RNs. What they would want to do is to pin the assignment on the LPN and want to tell the LPN that, oh, as a nurse, that's her duty. No, it's not her duty as an LPN. It's an RN duty where that particular duty is concerned. So that LPN can refuse that assignment without fearing any backlash. And if anybody comes back and backlash, they can report them. Okay? So I'm just letting you guys know that. Don't let anyone order you to perform any unethical assignment or assignment that is outside of your scope just because they want to look good and just because they want numbers or just because they want the money. Don't. Please don't. Don't let anybody threaten you. It better you walk away because you got to know where to draw the line. It better you walk away with your dignity and walk away with your license. Because guess what? There are many jobs out there. I know a nurse who lost everything in that incident. See somebody, we're talking about the Florida incident. Listen, you're going to have step higher than where you are. Lord God, listen, let me tell you, Mama, listen, I meet people who I've never met before for the first time. And when I speak, they said, no, you need to go back. You need to make sure so you get your RN. You need to make sure so you go up higher because you are not going to be a regular nurse. You're supposed to be an educator nurse. That's what a lady told me last week. She said, so I concur. And I'm taking all these advices and I'm going to continue to go further. Even my administrator, when I was in LPN nursing school, she told me, she said, I see you as an educator. I don't see you as a normal nurse. Yeah. You know? So know when to walk away. You understand? The proper response. Listen, you don't have to be hugger with them and say, oh, man, I do this already. No, man, you're just calm and quiet and cool because you know your rights. Once you know your rights, you don't have to be in a no hugger with nobody. You don't have to be in no argument with anybody. The proper response, it depends on the circumstance. And once you're absolutely certain that the policy, wherever you work, states the Nurse Practice Act prohibits you from doing the work at hand. For example, you don't know how to do a wound debridement as an LPN. That's supposed to either be an RN who is certified, or you have the expert wound nurse. So guess what? Once you know that your Nursing Practice Act prohibits you from doing that assignment, please walk away and refuse that assignment at any cost without feeling any type of way and without thinking who is gonna feel. Okay? Without apology. I'm saying that. So please tap in authentically. Come in, guys. If you're joining for the first time, we welcome you. We're family here, and we're here to talk about the real deal. That's what we do over here. We keep it raw, uncut edge, like Muta Baruka would say. We don't splice, we don't dice. We just speak it like it is, with dignity. You understand what I'm saying? Our tagline over here is that you know the deal, we just keep it real. We keep it real. Yeah, adjust reality. All right. So if you're just joining for the first time, welcome. If you're not, tag a friend, tell a friend to tell a friend to tell another friend. If you don't know as a nurse, you call your state, your board of nursing, utilize the resources, call them, not afraid. Call them if you're unsure, just to make sure that you are on the safe side, because at the end of the day, the goal is to make sure that you're providing the proper service and care and safety for your patients, and you're protecting yourself and protecting your license. Once you know the deal and you have everything packed, when you refuse these assignments under certain abnormal circumstances, you don't have to worry about being charged for patient's abandonment. Like I said, if you go ahead and you take on their semen and then you start grumbling and then you give up on a patient, then that's where patient abandonment comes into place. And we don't recommend that. I'm not recommending that. So I want you to listen to me keenly. I'm not recommending that. A lot of times, again, supervisors and your new workplace take for granted that you know how to. Remember, you have different kinds of nursing. Like I just mentioned, you have nurse educators. That's all they do. And even though they're educating you, teaching you the steps with the theory, that don't mean that they have the skill. Because remember, practice become permanent. They say practice makes perfect. And if you don't do something every day, it's just like I learned Spanish in high school. I learned Spanish in university all the way up. I did intermediate Spanish, but because I don't use it, I lose it. So it's the same thing. Even though you know how to ride a bicycle, going back to it is going to take a little time for you to get back in the groove. So it's the same thing. If you don't normally, you have school nurses, you have nurses who just do one-on patient, they're still a nurse. So it doesn't matter where they work, they're still a nurse, but it doesn't mean that we should not take for granted that all nurses, they should know how to. Are they going to tell you that, oh, because they're doing it? They probably just was a school nurse for 30 years. So they never had any grounds to do a catheter, to insert a catheter in someone, whether a male or female. They didn't have to do any IV insertion or take out an IV. They didn't have to do any JPEG tube feeding or passing of medication. They didn't have to do any colostrum bag, anything like that, because they're probably just dealing with children at school. So we can't take for granted that they should know. No. So we ought to teach them, and when we're teaching them, we have to give them enough time so that they get it. I'm not saying you're going to teach them forever, in the sense that some people head tough like board, but at the end of the day, 1 day training, especially you go on some people's orientation, you only get 2 days and 3 days training. What goes up? And you expect them to perform quality service and expect them to perform efficiently and effectively and safely. No. Don't make nobody put you on a 1 day training, especially if you are a new nurse, for Christ's sake. Don't make nobody put you on a 1 week training, a 1 day, 2 day training and then let you go in and see if you go fend for yourself until I say, oh, this is how it runs. Oh, this is how it runs here. No. Again, you find that you're assigned, the nurse to patient ratio is so high, you don't have enough CNA to assist you. And then sometimes the CNA, them don't care, because you find that sometimes I've seen this where the CNAs are the ones who do the vital signs. And because them probably do them 3 job, I'm not knocking anybody, them come in tired and them a quarrel too, so them a get 10 too much patient. And then you see them just make up numbers a gear for the vital sign. Tell me if you would like that to happen to your loved ones. Because that's a question I used to ask them as a nurse. Because they never like me. Because me depend them like white pan rice. Don't do that. If me see you do that, me ever call you out on that. Don't do it. Because what if it was you or your loved one? Would you want nobody make up number and give me, let's say you have, because I know some of my patients. So I know, for example, a patient who normally would have like problem with their oxygen level. So it would be like on the low. So, we have to watch them and give them oxygen as needed, or they would have to continuously be on oxygen. So for example, they do the vital signs. So they do the temperature, they do the oxygen, they do the blood pressure and the respiration. And I find that them just sit down and write numbers. And you can know as a nurse, when the numbers are fictitious, because you see the trend. And I would go to them and say, did you actually do this? Yes, no, you didn't, because I've been observing you. You don't want nobody to do that to your loved one. You don't want nobody to do that to you. So why are you doing it to other people? I'm not going to shortchange anybody. Again, if I'm going to have to shortchange you, I'm going to refuse some assignments, or better me go back home. They have no empathy and they are in the wrong field. That's what I'm telling you. I'm telling you, some of these people have no morals or integrity. No, they don't. Never be afraid to stand up and speak up about what's right. Listen me, Ziven Naturals Miami, this is one girl who know how to stand up and speak. As me telling them, I did love chat. People used to say me like was a chatterbox, but me never know the reason why till now. Me never know, so one of my calling was to be an advocate for myself and for others. And I will not stop speaking. I will speak until the day I die. I understand some people will say choose your battles and, you can't speak out all the time, but I think it's warranted to speak out because a lot of people are being affected, both from the nurse end and both from the patient and client end. Because if you have a nurse who is burnt out, somebody are going to get shortchanged. But I know me. Somebody's going to get shortchanged. So we want to do the thing the right way. So like I said, get edified. Call your board of nursing. Consult with your facilities policy manual. That's why you have to read them. Read them. When you have in-services, do the in-services them and take note. That's what in-services are for. Not just click, 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 forget the hours. No, and click, click, click for say you do the in-service. Read. If it's a 2 hour you have to do it now, take your 2 hour, and if it want more time, tell them say you need more time. But you read word for word. In a certain fields, just like certain contract, when you go at the bank and read the contract and you just sign, and then when push come to shove and then catch you in one part and tell us it was in the contract. And the same thing with in-service. I would implore with you, my nurses, when you get your in-services to do them and take note. If it's video and audio, listen. And if you have to write down and put in your notebook, you write down and put in your notebook. That's why they have them. So, for example, me the other day, other than the patient issue where I got the COVID patient and then them want to tell me, say, oh, them can't guarantee, say, because I said, okay, if you're going to tell me that as a nurse, I have to see the COVID patient, that's okay. But here, I'm going to tell you, say, I'm going to see that patient last. Then them are going to tell me, say, them can't guarantee me seeing the patient last because we get paid for, like, the proximity where we go. So for example, let me tell you. So let's say the 5 patients I got, let's say the COVID patient was in proximity of 2 of those patients and the other 2 they over east and them over here. What them want to say me for still see the COVID patient because them don't want me do the 2 clean one, leave the COVID one and go over, so go the next one, come back because they don't want to pay me. That's not my prerogative. That's what I told them. I said, that's not my prerogative. And you know better that it's from clean to dirty. Unless there is an emergency going on with that COVID patient, then of course I will agree to you that I will have to run to that patient's rescue. But again, my question that I want to ask you, if that scenario happens, how am I going to go forward dealing with the other clean patients after seeing that COVID patient? That was my question. Them couldn't answer me. So them start backlash me and me and them toe to toe. I had to tell them, you're not going to intimidate me. You're not going to bully me. Because they know better. You understand what I'm saying? You're not going to. I'm sorry. I know what is right. You can't tell me how to proceed to deal with the other patients after dealing with the COVID patient. And like you send me one for go change and beard and do the works. Yeah? You're going to tell me about donning and doffing. Donning and doffing don't stop any exposure or putting me at risk of being exposed and then going to the other patients to put them at risk. So you don't tell me nonsense. Okay? Because my patients come first. My patients come first. My patients come first. And my license. All right? So that's very important. Very, very important. So know your scope of practice, know your nursing act, because those are facts. Those are your facts to run with. And once you know those, nobody can come with you with any recourse. Nobody at all can come to you with any recourse when you refuse these assignments. Once you know your rights and your obligations, just tell them like it is. I'm inexperienced, I'm limited in terms of training. It's okay. So sometimes you bargain with them as well. So sometimes in your refusal, you can bargain with them, because one would say, oh, you're going to always refuse this assignment. If I have to, I will. If I have to, I will. Because, for example, you're going to send me to a patient's home. And when I look at that patient's home, it is so dingy. You know the word dingy. When I say dingy, and you're going to tell me that, oh, unfortunately, I have to go in that dinginess to provide service. No, I don't. And I'm going to refuse that assignment. I am going to refuse that assignment because one of my in-services that you allowed me to take told me that if I, who is providing service, I understand that a patient or a client is at risk, But when you are going to take on that assignment, you should have done the necessary evaluation and assessment to either take that patient out and put them somewhere safe where they can get the best care ever until you sort out that home situation that is in such an atrocious condition. So you don't tell me that I have to do it. No, I don't. I am going to refuse that. You understand what I'm saying? Someone would say, okay, so when you refuse it, you want somebody else. That's on you. It's on you. You should know your limit. But I am going to refuse it because my safety doesn't necessarily mean that I'm going to fall or my blood is going to be drawn or I'm going to be exposed to chemical. Safety means health as well. Health hazards fall into safety. And if I believe that an abode is going to put my health at risk, I am going to refuse that assignment. I'm sorry. That's why you have social workers in some, depending on where you work at, and that's why you always have a social worker, and they should do a very good assessment when they go out. But as I said, some of them go, some of them don't even touch nothing, and because of the money, they say it's okay, and then want me to do the dirty work. It's not gonna happen. You're gonna know. Make it home from church to reach to coach the live, to catch a live. No problem, Angie. Welcome. Yeah, man. You understand what I'm saying? So you have to know your obligations. You have to know your rights. You have to know when to draw a line, because you have some places, they're just known for dirty work. They're just known to do you dirty. They're just known to be don't care. If you check their tags from what you call that department, that the state, what a name? If you check how many times they're tagged for stuff and how many, when they come for assess their facility, how much tags them get, you'd be surprised. You need to know those stuff. When you're going to an employment, find out about these things. These things are very important, because that will tell you if this workplace care about their employees or even care about the patients or clients that they're attracting. It is important. These are things that you have to know about the company that you're applying for. Not just go for your job because, oh, them are pay good and the money enough. You understand? Or, oh, I just want to be there for patients, like I would say. No, find out these things about the workplace. What are they known for? Is it OSHA? No, not OSHA. Jacob. See somebody, yeah. Talk show sis. Jacob. Jackie type it there. Yeah, she know me I talk about. Yeah, not OSHA sis. You have to know about these workplaces, because they will set you up neatly, quietly, discreetly, and you don't even realize it because you're brand new and you always hear, say, as a nurse, you're supposed to be a nurse. Be a nurse. Want to be a nurse all the time. That's the way you get. And see who's going to be there with you and for you. You're going to be there all by yourself. You and Jesus Christ, if you know Jesus Christ. So you better know these things. No, I'm not being negative, guys. I hope no one is taking me in the wrong light. I'm just shedding some light, and so others can learn and not fall into the trap that others have fallen into by going to prison, getting, arrested and charged for abandonment. I'm saving you. I'm saving you by edifying you, opening up your eyes so you can know and see things for what it is. Don't let nobody push you, and nobody setting a trap for you, because they don't care. At the end of the day, they don't even remember your name the next day. Work goes on. That's how they look at it. There is a form. There's also a form. I remember in nursing school, they told you that sometimes when you already accept the assignment and you say, so let's say in this case, you already accepted the assignment, but during the course of the assignment, you realize that this is something that they want you to do outside of your scope. They're asking you to do it because for whatever reason, they're short staffed and this and that and whatever. There's a form. It's called an assignment under protest form. Write it down. An assignment under protest form. You can fill out that form, describe the task or the assignment, let them know that you don't feel equipped to handle the assignment, the reasons for your feelings, and the training that you have, and that you would need to be more confident and better prepared. When you sign that form, if they force you to do the task, because they always say you got to listen and be obedient to your superiors and not be insubordinate, they use a little cute word there. You make sure you describe it like I mentioned on that form, and then you can go ahead and perform the task. So what am I saying? Or why am I saying this in this scenario? When you fill out that form and you put all the pertinent information on that form and you go ahead and you complete the assignment, if there were any issues or errors on your part, guess what? And you have to go to court, this form will tell the judge that, look, judge, I did let them know that I did not feel comfortable, but they forced me, and hence here is my assignment on the protest form. Guess what? You're covered. A lot of people don't know about that form. And how I know? Because I've asked a lot of seasoned nurses in my jobs about that form. I didn't remember the name. And nobody knows what I'm speaking about. They make it seem like I'm the little rebellious one. Nobody knew about that form. But that was one of the first things I learned in nursing school, and I will not forget. You see, I used to sleep a lot sometimes in the car. I say tired till my buck, man, and I fall asleep. So I used to record. I still have all the recordings for my nursing class on my phone. I still have them on my phone. You understand? Because I can always go back to some important, very important. I mean, everything is important, but you have some very, very important things that you don't want to forget. You want to always have that with you anywhere you go. Like, for example, for me, I can work in most states that is compact with Florida because I have a multi-state license. So I have to also know the scope of practice in the different states if I should go into a different state. So any nurse who is a multi-state nurse, you ought to make sure that you find out what are the scopes of practices for these different states, because like I mentioned, these scope of practices differ from state to state. You have to make sure that you cover your rear, because if you don't, ain't nobody going to do it for you. And you want to do it early and know that you know, because when you knowledge is power, you always hear knowledge. When you have that up here, no matter what they try to say or do, they cannot take it out of there once it's embedded in here. That's why so many people dead from COVID because of shorthand procedures. That's another thing. Exactly. Again, we were unprepared. A lot of people didn't know the know-how, still don't know the know-how. And we jump good because we are play expert and we are play heroes. And we were just not equipped. And we felt afraid to speak up. And we just jump into because of the money and things, so we can do this. And we're just doing what they tell us to do. And that's why a lot of people died. Because you, as a nurse, like I mentioned in the get-go, you should be an advocate. So for example, and I'm going to give you a good scenario. Let's say the doctor evaluate a patient. They say they have a headache or pain, abdominal pain, whatever, and the doctor prescribes something for them. Remember now, the doctor have how many patients, how many different facilities that they cover on a particular day. You as a nurse, you should be familiar with your patient, especially if you're working at a set place, set unit on a daily basis. Floaters, I'm not speaking about you. As I said, every situation is different. So that's why we have to listen and listen keenly. So let's say you're a nurse who works at a facility and you are assigned to a particular unit on a daily basis. So you get familiarized with your patients, after dealing with them day by day, over and over. You get so used to them, you know their names, you know what this one is capable of, you know what that one is capable of. So your doctor goes ahead and evaluates, examines this patient and prescribes, say, aspirin or Tylenol or whatever for the pain, or Percocet, depending, Tramadol, whatever, pain medication. You as a nurse should know that, okay, this person has a bleeding issue. They have a bleeding issue. So should catch it. The doctor might not catch it because then he has so many things and he's trying to be quick most times. I'm sure you all know what I'm talking about. And you as a nurse now should be able to catch it and say, but doc, no, this medication. That's why in nursing school, they always say you got to know your medication and the contraindications, meaning contraindications mean that certain meds cannot go with another medication. You understand? Because it will cause adverse effects, severe adverse effects. Sometimes it's mild, sometimes it's very severe. And you don't want that to happen to you, okay? So you should catch it as a nurse and say, oh no, doc, this medication, this patient can't take this medication because they are already on this medication. And two of them, it's a contraindication. Many times I catch it as a new nurse, and then the other nurse think that I'm showing them up. No, I'm trying to put you on track and let you know that, listen, if steady coming here, you would have been in problem. The doctor would have been in problem. Many times doctors thanked me when I worked in the facility, thanked me like big time. Me not brag and boast, but give me a brag and boast because God. You understand? They thanked me because me catch them little stuff. And said, doc, oh no, the patient here, you know, them can't get the Percocet with this other medication because it can cause a serious effect where it can knock them out and even cause death. So you have to advocate. You have to have good judgment as a nurse. You call the shots. Even though the doctor is higher than us, most times we call the shot because the doctor is depending on us. And that is the reason why we have to be detailed, pay attention, and advocate. Advocate for yourself, advocate for your patients. Yeah, don't just jump in because you think you're a nurse from what we fill up and you feel so you know it all, or, you know, no. Especially COVID, nobody knew how to handle COVID. Like Lizette is saying, so many people died. You know, because what I understand, I don't know for sure, is that some people got vented, and then you know, putting on a vent was not the best thing. You know, so that's what I'm talking about. Now, you know, once you fill out that form, always make sure that you keep a copy. One thing that you always hear in nursing, that anything that was not documented, that means you didn't do it. Even though sometimes you do it and you forget, but make sure that documentation, document. Please document, because at the end, the other saying to say, you know, too much sometimes is whatever, you know, just keep it, you know. I'm not telling you to put a whole paragraph, but sometimes it's good to be detailed, because just in case 5 years down the road they have a court case, guess what? Those notes will cover your rear. Anything that you've done or said, document. It is important. So if you have to fill out this assignment on the protest form when you're given unethical assignments to do that is outside of your scope and they're pressing on you to do it, go ahead, fill it out, keep a copy for yourself, make sure your supervisor get a copy, make sure the administrator get a copy as well. And if you realize they continue to do this, you take it up the chain of command. If it's a one-off situation, you can say, okay, it's a one-off situation, but you have some of them where them will text it. Especially if them ask if you do it once and you do it, them come back again and them come back again. So you have to be wise as a serpent. You have to be wise as a serpent. We turn away a lot of patients when you tell stop the aspirin and blood thinning, and 7 days they will take it and we can prep them for. See, there you go. See? Sometimes they're going to do procedure, right? So you have to let the doctor know, oh, doctor, you know, tomorrow they have a procedure within 3 days, so we can put them on the aspirin. So you as a nurse, you have to be an advocate for your patients. Trust me, you have to be an advocate for your patients. Safety. So let's go back to the scenario. You go in for a 12-hour shift or an 8-hour shift, and you're taking care of your patients and you're providing them with the best nursing care ever possible. You're the best nurse, always going above and beyond. When you look at your patient assignment, you realize that you have so many more patients than the norm. You only have limited CNA for your entire nursing unit. It happens. Your charge nurse who is there has a full load as well. Hand is full, hand is tied. Because remember, if anything, you would have to lean on your charge nurse. So we're giving you this scenario. So your charge nurse hand is full, tied up with assignments. What does that make her? It makes her less available. Him or her makes him or her less available to you for help and your support. All right? You hear machines beeping. You hear alarms sounding, going off all over the place. I'm sorry, I'm on the live. Please turn that down. Patients yelling. You're going to stop and think to yourself, is this safe? First thing you're going to ask yourself, is this safe? Because, I mean, you can have a patient ratio to nurse ratio high enough, but it kind of simmering. You know what I'm saying? We have to stop and think, is this safe? Does it the scenario that I'm putting to you, does it sound familiar? If you sound familiar, have you seen it? Have you been to the hospital to visit someone and you've seen it just as a bypasser, someone who's just passing by? Have you seen it? Being a nurse or a CNA, have you seen or, heard about these situations? It happens. A lot of people don't want to talk about it. Again, you're given an appropriate assignment. It can be very overwhelming, very stressing. And then you complain and you grunt and you provide less service to the patients. The patients suffer. Remember that your patients are expecting you to show up and to take care of them the best way, providing all their needs. And I'm sure you want to help, but can you help everybody in a certain given situation like this scenario? Can you? Where do you draw the line? When do you say no to some patient assignment? What is considered an unsafe assignment? Again, can you refuse an assignment as a nurse? Yes, you can. And I will say it again. Yes, you can refuse an assignment as a nurse if you deem it unsafe, unfit for your level or your skill set. You can refuse an assignment. Don't let nobody tell you anything. Now, one would say, what is considered a safe assignment versus an unsafe assignment? What is an appropriate safe assignment versus an unsafe assignment? So I would look at it and say that any patient assignment where the nurse can safely and effectively provide all the necessary care for your patient, then I consider that safe. Again, safe in the sense that you can provide safe and effective, efficient service and care for your patients, and you don't feel overwhelmed or feel like you're shortchanging or cutting corners. And you have the necessary tools, that is important. The necessary training, that is important. You have all the meds available, because sometimes you're going on the patient, they're missing meds and nobody reordered meds because nobody don't care. All of this is important. You have the necessary knowledge set. All your resources are in a row. You have the necessary equipment. You have all your oxygen just in case somebody who is known to get intermittent oxygen because they're known that their oxygen level will go down. You have glucagon kits for someone who's diabetic and they're known for their blood sugar to go very low. Listen, I had an experience, I'm gonna tell you this, recently, where I had 32 patients. I had more patients than the other nurse, who was a RN. Out of my 32 patients, I had more acute patients who were needing like one-on-one. And I had a patient who was diabetic and was known for her blood sugar to go very low. It was 2 o'clock in the morning and someone said to me, go check her blood sugar. You see, and it's a good thing I listened to the voice. And when I checked the lady's blood sugar, it was 39. You know how low that is? That could have put her in a coma. Okay? 39 when I did the check. I said, no, sir, I'm going to check it again. 44. So 39.1 and 44 on the next. I said, no, that's still low. First thing I searched for and tried draw for was a glucagon kit. Because like when it's that low, you need a kit to shot them right away, because that's very low. Of course, when they're low on sugar, you give them juice or, a snack with sugar. But in this case, 39, because the normal level is 70, right? A normal level for blood sugar is 70. 39 is extremely low. If you know somebody who's diabetic or you are diabetic, you would know that what I'm saying. 39 is extremely low. That could put them in a coma. That could put them a coma next to death. Okay? Very low. And like I said, I don't know. I know that I was supposed to monitor her, but not at that time. But something said to me, go and check her. And luckily, she was one of our people. And I gave her the patwa and said, listen, Mama, you got to take this. You have to do this. There was no glucagon kit. I immediately called the supervisor. No answer. I text, and up until this day, I've not received a response from the supervisor. Okay? I had to grab some orange juice. Then when I went to the cafeteria to get the orange juice, they were so icy. Luckily me know how to take my hand and make fashion. Me have to crush up the ice real quick so it can melt out and, that it no cramp her when she drink it. And me have to dab some sugar and I hit and give her some, mama, you gotta drink this for me. You gotta drink this for me. Me find one sandwich says she don't want that. Me say, no, you don't want it, but you have to go eat it. Lucky thing she was a Jamaican, like I said, I may have to talk to her in a Jamaican style and convince her, say, listen, we gotta do this ASAP, like right now. And within 15 minutes, it was up back to 100 or something. I said, thank you, Lord. And while me I do that, me I pray to God, saying to God, don't make no incident happen tonight. I mean, I wouldn't be at fault because I'm doing everything. But at the end of the day, I was bogged down with so many other things. And thank God I followed my intuition and went and checked the lady. And then while I was there trying to monitor her, then alarm will go off over there. So right now, she's my priority. What can I do? I only got 2 hands. I'm one person. And I remember when I was giving the report in the morning to the other nurse, she's like, oh, because I'm telling her what was not completed during my 8-hour shift. She's going to tell me, oh, you got to do it. I said, no, I don't. I said, no, I don't. There's nothing they might have to. I'm finished my 8 hours day and I'm done. And that is the reason why I'm being a good nurse by reporting to you, let you know what I did. Because I'm not going to say that I completed something when it wasn't done. And I see nurses do it all the times. Again, because they don't know that they can refuse an assignment. So when they get bogged down with all these work, they shortchange and say they did provide the patient the service, and sometimes the poor patient not see them. I'm telling you. I'm sorry, but I gotta speak. I'm telling you, it happened. I had to call out seasoned nurse, RN nurse already, and them not like me for that. But me have to talk, because guess what? What if it was me? Or what if it was my loved one? Me don't want that to happen to them. I don't want that to happen to them. I'm on the live. I don't want that to happen to them. So I have to call them once and I say, don't do that. You didn't provide the service. Do not document that you did it. And that is what a lot is happening out here to make themselves look good. But I'm not going to do that to make myself look good. I'm going to report to you as the nurse coming on. Hey, I did not get to do this treatment. I did not get to do this to this patient. And I will also document that this was not done. Waiting them can't do me nothing. But then I can get in trouble if I document that I provided the service when I did not. Of course, I can get in trouble for that. So I told her, I said, no, honey, I don't have to. My 8 hours has come to an end. And here goes, I'm turning over to you. I'm not trying to do you any injustice. It's just that I'm one nurse and I was assigned 32 patients and I had this going on all night. I'm sorry. Here goes. See you. Bye-bye. Oh, thank you so much, Zivan Naturals Miami. Listen, and I know there are more nurses out there like me, but sometimes they're afraid to speak because they're afraid of backlash. But we have to think about it. What if it's our loved one who is at risk for getting service that puts their life at further risk when they could have lived a little longer? Think about it. Or what if it's your family member who's a nurse who's being beaten bad and being backlashed and retaliated on because they stand up for justice? Somebody have to stand up for justice, no matter what comes. Because all they can do is tell us that don't come back at them workplace. Bye. Somewhere else needs me. And real recognizes real. Because let me tell you this, and I'm not gloating, I'm just telling you, the first job that I had was at a facility. And when I told him that I was going to leave, I had a talk with the regional manager. And I said, look, one of the reasons why I'm leaving is because this place is disorganized. And it's not a one-off situation. I've been here for months and nothing seems to be changing. And I can't work in a condition like this because at the end of the day, if you're going down, I'm not going down. And I told her that anywhere I go, I am in it to win it. And anywhere I go, that place has to be number one because that's the only thing I will accept is number one. I told her plain and blunt. And when I told her what was going on, she said to me that Cleopatra, we're aware. And guess what? She was ready to offer me the DON position. And when the MDS said to her that, oh no, she's just an LPN, the lady said, I don't care what her title is. She has the skills and she has what it takes to be a DON. And I had to turn it down. She said, I'll give it to you for you not to leave. I said, no, I can't stay. Then they hired a unit manager. When the unit manager came, she tried me the first time and I had to put her in her place. Because one other thing I want you to know, that when you're under pressure because you're being told that you're a nurse, you're supposed to do this, don't you ever do anything. Say, for example, you weren't at work yesterday and something was incomplete, and then the unit manager may come to you and say, oh, you need to finish this and you need to fill this. Don't you ever do that. It's your signature. You weren't there yesterday. No, that's the unit manager's job to finish that. That's why they hire unit managers, for when a nurse, or you wait, or that unit manager should wait until that particular nurse who was on duty yesterday comes back to work to finish that assignment. Listen, I know I may sound a little bit off and weird to some of you guys, but I'm just teaching you something. You're not going to find my signature on anything where I was not assigned that day at work. For example, I started a new job recently and there is work there from October. And they want me to do the care plan for it. I said, no, it's not happening. I wasn't here in October. Not happening. If I put my signature on that and 5 years down the road and this goes to court, guess who the judge is going to call? They're going to subpoena me to come to court when I know nothing really about that. I just signed. Not doing it. If it's not when I was at work, scheduled at work, I'm not touching it. I'm sorry. You can't force me to touch it. I will not touch it. Again, I'm just sharing information with you. It's up to you. It is up to you. But I know I'm not touching that. No, ma'am. No, sir. I'm sorry. I'm going to tell you with respect. I'm sorry, but I'm not touching this and I'm not doing it. I was not here. And she tried me and she go on and I gave her back the paper. I said, I'm not doing this. She came back to me and she said, Cleopatra, I'm sorry. She apologized to me. And when she learned that I was leaving and she realized how I did my job, she said, wow, I appreciate you. She wanted to give me the assistant DON position. I said, no, I'm going. So a lot of people will say, oh, because Cleopatra, because they tried me. Some of the old nurses who were there for like 10, 12 years, 20 years, they say, who are you? New nurse, new employee. Who are you? How could you? They said it to me. They tried to set me up too. Because when you are for something, people also try to set you up. So you have to be smart and you have to have your eyes and ears open and your sixth sense open. They tried to set me up because I was doing what I was supposed to do, and they didn't like it because they would come in and just do what they feel like doing and they don't care and nobody would say anything. But I'm not going to see it and know that you're putting a patient in jeopardy and not speak about it. No, it's not going to happen. It's not right. Like I said, I put myself in someone's shoe. I put my loved ones in someone's shoe all the times. And I always ask them, would you love that for you? No. So why are you doing it? Why do you think it's okay to do it to someone else? It's not right. So let's continue. When should you refuse an assignment? Too many patients. Are you assigned too many patients? I know there are some states, they have mandatory patient ratio. Like I know, like California, they do have mandatory patient ratio. And for those other states that don't have mandatory patient ratio, they will try you and tell you, oh, this is how it works here. Or, don't let anybody try you. Know what you need to know. I think Massachusetts too, for my Massachusetts viewer, they also have a mandatory patient ratio as well. California and Massachusetts. Yeah, those are two of the states that I know that they do have a mandatory patient ratio, meaning that you are assigned a certain number of patients and it's mandatory. Not all of them. So I want you to know that. Okay? And some states, they do, because of that mandatory regulation, they have to be, mandatory reporting requirements for staffing. They have to report that. Okay, while others may have staffing committees with some nurse members to assist, I'm sure, in making the staffing decisions, but it's not mandatory across the United States. So again, it's important to know how many patients you can manage. Okay, so you will learn that as you go along as a nurse based on your experience, how many patients is too much for you. Don't take them and then complain and then shortchange the patient them. Don't. You hear me keep stressing that? No. It will depend also on your unit's acuity level. Like I said, as an LPN, you got to know that the less acute patients are supposed to be delegated to you, not the worst patient, because like I said, the RNs will give you the worst case scenarios and they just take the easy cases for themselves. Don't let that fall on you. You speak up and let them know that, unfortunately, ma'am, based on my scope of practice and the Nursing Act in your state, you're giving me the most acute patients and I can't handle that. I will have to refuse it. You can refuse on that notion. Like I said, it's not everything you're going to jump up and just refuse. You got to know when to refuse. So in that scenario, you can refuse. Another scenario where you can refuse a patient is inappropriate distribution of patient acuity, like I said, in other words. So they want to give the LPN the most severe and complex. No, it's not happening. Not with Cleopatra. And I'm not going to do unto others what I don't want to be done unto me. I will not do it. Not because you're an RN. Just like you have some nurses who feel like the CNA should do everything when you can assist. If you're not dealing with a patient, you can assist your CNAs. You can. Nobody don't want to touch feces because they're a nurse. Don't do that. That's where teamwork comes in. Again, not because I'm explaining to you about refusing an assignment means that I'm not a team player. I am a team player. But again, I know my rights and obligations, and I want you to also know your rights and your obligations. All right? So think about that. Think about you have, how much do you know about dealing with COVID patients, like someone mentioned in the chat earlier? What acuity level can you manage with COVID patients? Who probably that patient have to be on continuous BiPAP. You understand what I'm saying? Do you know how much do you understand the process here where, how much do you know about how BiPAP works, BiPAP machine? You have to know your level. Also, take into consideration how many you're going, how many discharges, how many admissions you're going to have based on your level of experience. Sometimes they want to put all the admissions on you, and to admit a patient, it's a tedious process. I mean, once you get accustomed to it, it becomes easy probably for some people, but it's always a tedious. A lot of things you have to do when you're admitting a patient. So know your level, know where you stand, and like I said, you can refuse. Okay? Communication is key. I don't say you don't have to be disrespectful when you're refusing an assignment. Be polite, be respectful, and always have close communication with your team. All right? Because, we still need each other, but know your bounds. Inadequate knowledge of training. Know how knowledgeable you are. Are you being asked to care for a post-surgical patient from the gynecology? Somebody who probably just had a C-section. Do you know how to deal with that? How much knowledge do you have? You normally would probably just take care of patients recovering from a stroke. You don't know how to deal with someone who's had a surgery. Are you just going to take it when you don't know? You got to speak up. Are you able to take care of pediatric patients, meaning children, when you're always used to taking care of elderly? Like I said, not because you take care of elderly mean that it's the same level of care for children. It's different. Maybe you're being asked to do something that, again, you think it's out of your scope. Know your scope of practice. Voice your concern. And ultimately, refuse the assignment if you have to. Another grounds that you can refuse an assignment, no supplies or help. Some places are known for that. They never yet have supplies, not even over-the-counter drugs. No matter how often you report it to them and you tell them to order, they keep telling you, oh, this and that. No, you're the one doing the job. You need your supplies. You need the help. So if you're always going and there's short staff and then the charge nurse or the supervisor is always packed because they also have to be jumping in, then who are you going to lean on for support? Everybody you go to them, oh, them busy and them are bark after you like a dog. Who is going to support you? You probably can call a friend, but you know, how reliable is that friend? That friend probably sleeping because they worked last night all night, or probably that friend is at work too busy, can't talk to you. So who is going to be your support? So inadequate knowledge or training, again, you can refuse that assignment. That could be a good reason to voice your concern and ultimately refusing. No supplies, no help. Do you have all the equipment that you need? Do you know where the code card is? Some places them don't even have a code card if there's a code blue. Is that okay? No. And that's how they have the place running. But yes, so when state come, there's a code card available. But under normal circumstances, you don't find one. What if something happens? You're there, no supervisors there at the time. What are you going to do? How are you going to practice safe and effective nursing for your patients in an emergency? Do you have enough medication stocked? Is the machine working? You know how many times I draw for oxygen machine and want me look at all of them not working? Not one of them is in working condition. Because guess what? The nurse before never made the report, never put in the order, said, okay, we need machines. Because guess what? She was so tired and overwhelmed, complaining all day. This is what I'm talking about. If you ever find yourself in any of these situations, if you ever feel like your license or patient safety is in jeopardy, you can refuse the assignment. The American Nursing Association upholds you based on your professional and ethical responsibilities. You have the professional right to accept, to reject, or to even object in writing and verbally. You don't want to put anybody at any serious risk. Yeah? It's only right, it's only fair. It's your duty as a nurse to raise concerns and refuse if you have to. So no matter nobody tell you, okay? Know your rights and be prepared to state them. Know your rights and be prepared to state them. So when you tell them, they already know. Like I said, they will try you. And once you do it one time, it's like you're always going to have to do it because you did it before and you did not stand up and you did not speak up. Be prepared. Refer them to the code of ethics. There's a nursing code of ethics. Refer them to it. In any decision making, you refer them to it. If you have to call your board of nursing, call them. They will back you as well. Before you decide to accept any assignment, so you're going, that's why it's important to do your rounds before you even take the report. Because when you do your rounds, you will see something and they ask the nurse, what happened? Then you see something in the matter that they don't know, which them already know, but to them not care. They don't care. Some of them, they know. So it's important before you accept any patient assignment, you need to avoid any activity that could be considered creating any nurse-patient relationship issues. And you don't want to accept it and then end up abandoning the patient because you're going to be in trouble, big time, big trouble. Yeah? If you have to view quickly scan through, the medical records of the patient, especially if it's a newly admitted patient, you say hi to the patient, you go into the room, find out what's going on with the patient, taking orders and all these things. You have to know, make sure that you have your ducks in a row. Do your research and be prepared. Always do the due diligence by doing your research and be prepared and keep everything in writing. And sometimes you can find solutions by helping, giving solutions. You speak to your unit manager and say, hey, here is a solution, because they don't know it all. And that's why we're in this thing together as a team. You might figure something out or know something better than they. Like I said, we never know it all. And you project and propose, put proposals out there with solutions that can help. So even when you're refusing, you're not just blatantly refusing. You can also suggest suggestions. You're still refusing the assignment, but you can also find solutions as well. So, like I said, I'm not just coming out here beating people bad. You understand what I'm saying? They have in the tube, but equipment not plug in. Listen, you know how many times I see that, Lisette? You know how many times I see that for real? Very good presentation, but I have to. Okay, no problem, my dear. I know how it goes. You're a very good nurse, sis, and I can see you care a lot about your patients. Let me tell you something, man. Listen, me will fight for my patient, them. Seriously. Like, I've had scenarios where I go visit my patients, I'm going to see them in some condition. I go on bad with the CNA, them, man. I don't care. Like, what? This is unacceptable. It is unacceptable. I don't care, and I don't want to hear that, oh, we're short staffed. You should have stated that to your superior and let them do something about it by calling in somebody else or figuring out, or them come city in too. Because as I said, sometimes some of these supervisors or some of these nurses, because of their title, they don't feel like they can fill in the gap. They don't want to. They feel that they are above everything else. So we have to look out for each other. We have to look out for each other. You understand? So, just know your rights, your obligations, because at the end of the day, we want to make sure that you're providing the best service and you're making sure that no one is at risk, neither you, your clients, or anything like that. And ask yourself certain questions. Where do you actually draw the line? You have some questions that you can ask yourself that you should be able to answer when you're making your decision to accept, assignments. What is the assignment? You have a right to ask, what is the assignment? And normally when I do, I remember one time I had a scenario where I had to rush to assist, and, it was a situation where blood was all over the place. And this was blood that was compromised. I don't have to say out what it is, big A. And nobody said anything. Now tell me, how would you feel knowing that you have to go into that? And one would say, oh, you got to expect anything. I understand that I have to expect anything and that I should always be cautious. But what about letting me know that I could be extra cautious? How does that sound? Because that's what they will tell you, that you should know as a nurse that you need to be cautious, or you should expect anything. But what about reporting? What about giving me that heads up? So I want to know, what is the assignment? I want to clarify what is expected of me. I don't assume. Certain jobs has taught me, even me getting arrested, I can share that with this. When I got arrested in 2018, it taught me so many lessons. You understand? It taught me to learn to read fine prints. It taught me not to assume. Even though my arrest had nothing to do with this. But I'm just saying that I know, that teach me something. You think me want nobody orange suit me and bungle me up like the last time? No, sir. Wasn't a nice feeling. So that's why I can come out here and speak and give you the heads up. Be certain of the details. What are the characteristics of the patient that you're being assigned? Don't respond to the number of patients alone, because like I said, you can have a number of patients and everything is going calm, everybody is mellow. But what about the critical assessments, the critical assignments of the needs based on the needs of each patient that you're assigned? The complexity of the assignments, the stability. Like I said, some of them may be stable and mellow. What about the acuity? Yeah? What are the resources available to meet those needs? Do you have an expertise care level for these patients? Are you familiar with the caring for these particular patients assigned? Are you a float assignment? Are you given a float assignment? Because as I said, sometimes you're floating, sometimes you do per diem. Are you cross-trained? That's important. In any job, whether nursing or not, cross-training is very important. Is there a buddy system? Because people will say team player, but then when you go, nobody wants to assist. Are you familiar with the place, with the unit? You understand? So you have to ask yourself these questions. Do you have the experience? Do you have the knowledge to manage the patients for whom you're being assigned to care for? You know, what's the location of your patients? Do you have some over there, so another set down the end of the hall? No, you don't want to. Or do you want to send me to Woy? No, I'm going to speak up. Is this a temporary assignment? Because sometimes, staff are located to assist in temporary situations, right? Will you be relieved? You have some people known to come on later. You have some places known that when you're to be relieved, no nurses are available. I'm telling you that I've seen that. And they're known for that. It's not like a one-off situation. I mean, when you have temporary situations, there may be a possibility to accept a difficult assignment. You understand what I'm saying? Because it's temporary. You get what I'm saying? I'm not just being or trying to sound negative. I'm just trying to show you how to get around certain things when you have certain difficulties that arise or certain situations that's very crucial. So, you might have a temporary situation where you can, get by with that one-off situation and you get a difficult assignment. I say, you know what? I'll take it on because it's temporary, knowing that there will soon be some sort of, support or reinforcement. That's okay. But you want to know if this place, if there's a pattern of short staffing, you want to know this. You want to know. Is the crisis an ongoing pattern? Is this crisis an ongoing pattern at this place? Or it's just an immediate need for crisis? That decision to accept the assignment may be based on that situation. If it's an immediate emergency or if it's a pattern, you want to know. If it's an ongoing problem, then you have the obligation to identify these unmet standards and let your supervisor know that, listen, this is an ongoing situation. I'm not going to tolerate this. And guess what? I have to decline this assignment. You can on these grounds. It's not your inadequacy, it's their inadequacy. They need to figure out how to deal with it. So you want to, when situations like these happen, it also results in what is called like a safe harbor. Yeah? Request for a safe harbor. Yeah? Another thing you may want to take into consideration, can you take on this assignment in good faith? In the sense that, okay, you will make a bargain with them and say, okay, I'll take on the assignment, but you got to make sure that, you're going to modify it. Like you're going to probably give this the more expert nurse some of these patients, or you're going to let the nurse, when she finishes with her patients, she will come over and assist me. So that's taking on the assignment in good faith. You understand what I'm saying? So with this being said, guys, I hope that somebody learned something tonight. I've been here for 2 hours and change. I hope that somebody learned something tonight, and also that we will practice what we learn, implement it, put it, enforce it also. Sometimes some of these supervisors, they need to be taught as well, because some of them genuinely are ignorant. So, we just got to look out for them too. So it's not about trying to bash anybody or trying to put anyone on the spot. It's for your own safety, for your patient's safety, and for the organization's safety. Because at the end of the day, if you have an organization who's always tagged by JTAG, then you don't want to be working there. Because when they're going down, you're going under with them as well. You got to know that. So guys, with that being said tonight, it's reality TV. We don't splice, we don't mince, we don't cut. It's unfiltered, it's raw deal. You know the deal. We keep it real all the times. And I hope that I can continue to come and speak about topics that no one wants to speak about, topics that no one wants to shed any light on, because it's considered sensitive, and we just continue want to push it underneath the rug. When we know there's an elephant in the room, we just have to deal with it. And like I said, I don't know it all. You guys can come, participate, share your knowledge, share your wealth of knowledge with me, your experiences with me, or solutions, how we can combat situations like these. But we want to make sure that at the end of the day, we are providing. Guys, my tea is in this, my detox tea. You can drink it hot or cold. You want to make sure that you're providing quality service, not just being empathetic and compassionate, but you're taking on tasks that you can comfortably manage, doing it safely, efficiently, and effectively. All right, guys, so I'm going to close out tonight. I just want to thank you guys for chiming in, for stopping by. You could have been elsewhere doing other things. See, one person said she was late because of other duties, but I thank you for coming in. You guys promised me that you would join me tonight. Thank you. And I want you guys to share this live, please, so that someone can be informed, someone can be edified, because, we're here for each other. And, if you disagree in some of the things that I say, you can always drop it in the comments. Feedback is always appreciated, and we can work with that. So good night. Thank you so much, Ziven Naturals from Massachusetts. Thank you. And I will come back next Saturday. I might come back before, but, I want to start back my Saturday nights. And I used to do my Thursday night testimony Thursdays. But, I want to be more interactive with you guys for the new year that's coming. So you guys have yourself a safe and peaceful holiday season. Don't OD. Just make sure you also find some time to rest and think about what I said here tonight. Please share this live, and I thank you so much for watching. See you guys next time. It's your girl, Royal Cleopatra. Again, reality TV. You can join me on YouTube. If you've not yet subscribed, please also make sure that you hit that subscribe button, share with others, hit the notification bell, subscribe to the QC Uplifting and Inspiring. Guys, before I go, someone reached out to me today asking for toiletries. As you guys know, I also give back to people. I just sent a barrel to Jamaica with food. That's what I could afford. It's coming from me. I also send some clothes. I liaised on with another ministry in Jamaica, and I sent like 4 bags of clothes. They were very appreciative of it. So they asked me if I can get some toiletries. So if anyone is watching would like to give back, and they said some children need tablets. I already have a tablet that I want to send. Pass a tablet over there for me, Danielle. So they asked me for tablets as well. I already have one. They asked me for 2 tablets. I already have one. And I would love if anybody could donate. I'm just asking if anybody could donate another tablet and some toiletries. We need some toiletries for the children in Jamaica. Like I said, I have liaised on with another ministry because I like to support. I like to give back. And most times I do it from my from me personally, because we can't force people to give. So this is the case for the tablet, and this is like a 7-inch tablet. So I'm going to donate this because they called me and asked me for 2 tablets. So I have one already. So if anybody else wants to donate, I will take that. Okay. Any toiletries we will also accept. Like, girls' sanitary pads, toilet tissues, or toilet paper, whatever we call it, toothpaste, soaps, things like that. We will welcome them, and we'll have a way of sending them to Jamaica. So, guys, let's do it. Others are depending on us. Each one reach one. That's what we do. All right, so keep in mind, if you can sponsor or donate some toiletries, we will appreciate that. Some people from Jamaica have asked me. All right, guys, so you have yourself a wonderful rest of evening. Enjoy your holiday, and I'll see you soon. Thank you so much for tuning in tonight. Good night. Peace out.